You get the best specialist to answer all your questions on matters health. Today in studio, they're not new faces. They're definitely here to have these great conversations. Now, according to what we've talked about 10 million Kenyans do have suffered and do suffer from asthma. Is that correct?
Yeah.
Awesome. And let our guest introduce herself. My name is Kerry Kagiri, and I absolutely love hanging out with you. This is Health Check. What you can do is from whatever platform you're watching us on, you can go ahead and share that. Share this information with someone. As you know, we always get you good. 22232 is where you can ask all the questions. You can call us when the call line is open. Good evening.
Good evening.
Karibu tena na tena na tena na tena.
Thank
He's
you.
our resident pediatrician.
Yes.
In fact, the way namuona pia, my children,
Yeah. All matters babies.
all matters babies. And he
Yeah.
absolutely loves what he does. Dr. John
Yes. Washira.
Karibu sana.
Yeah, thank you.
Thank you so much. He's definitely here. And where do you practice one more time?
Most of the times I'm at Tempisha Hospital.
Yes,
Yeah.
where I was born.
Yeah.
Maybe you saw me. No, you're a young guy. You are like still figuring out what career you want to get into. When my mom was looking for hospital. Anyway, let's not go there. And also our pulmonologist. I practiced that word and I've become an expert.
I think you've got it right this time round.
Karibu sana. Go ahead and introduce yourself one more time. I mean, everyone remembers you though.
Yeah, Dr. Waweru Munyu. I'm an adult pulmonologist and a critical care specialist.
Absolutely. And these two are partners in crime because pink is the new black. So they came in pink and we're absolutely ready to have this conversation. The first question, of course, someone is looking at the screen and maybe they've never related with this disease. Is it possible?
If you talk about 1 in 10 people having asthma, it means that every second household in Kenya has asthma.
Wow.
Every second home, there's somebody with asthma.
That begs to the question, what is asthma?
Asthma is a disease that affects the chest or the lungs or the breathing system. Simply put, it's a disease that's characterized by 3 main things. You have a problem. We have a disease of the inflammation of the airways, where they are swollen, they are clogged up with the mucus, and they are narrowed. That's what people would call inflammation.
Wow.
Yeah, so that would lead to difficulties in breathing, which may not even be felt, which may not be identified early, but when it's severe, then one would have the cough, the wheezing, the shortness of breath, the chest tightness, all those things that one would characterize as asthma.
Oh,
yeah.
Okay, awesome. What's the prevalence? Let's just have that conversation because you mentioned 1 in 10 people, so every other home.
Yes.
About.
Yeah.
Is that in children or in adults?
We're talking about, in both groups. Asthma is a continuous disease. It affects everyone.
Awesome.
Yes.
Let's talk about it. Daktari, what is the cause of asthma in adults mostly?
Okay. Asthma basically is a condition one is born with. And most conditions that one is born with, you live with. The only thing with asthma is that its manifestations vary from time to time, and also within the individual and between people, and I'll explain. Asthma, basically, as Dr. Washira has said, is a condition where the body reacts excessively to things which other people do not react to. In commoner terms, you call that allergy, but it is a special type of allergy in the sense that most other allergies are triggered by things you can tell. But in asthma, it may be internal irritants or external irritants. And the interesting thing with asthma is that once this irritant has come into the system or has manifested itself within the system, it triggers certain reactions. The key organ system affected is the lung. But we must remember that the airway, as Dr. Washira has put it, is more than just the lung. It starts from the tip of the nose, down into the throat, into the lungs. Also, there are structures around the face that we call sinuses. Yeah. The ears are connected to the throat. And remember, the food pipe is also very closely near the airway. So you'll find when you are assessing a patient who has asthma, for you to have good control of this condition, you must look at all these other surrounding structures. For example, some people will have allergic rhinitis. This is basically where they have an excessive reaction in the nose to different things like dust, pollen, smells of different things,
Fabrics.
and
Yeah.
so on, cuts and so on. And when that happens in the nose, the inflammation does not know that the nose ends here. It will just continue on the airway. And many times the patients will come and tell us, you know, it started with a cold in the nose and it has gone down into my chest. That's a very common presentation that a patient will have. So even when you are managing asthma, we have to look at more than just the lung. Let's check, does this person have sinusitis? Do they have dermatitis, allergic dermatitis or eczema? Because the skin also is part of that system. When one covers all these areas, then you can have very good control of asthma. Now, when one starts getting an asthmatic reaction, I'll use some things I brought here. This, is that clear? Yeah, this is a normal airway. Let's say this is a normal airway. And you can see that the caliber is quite big. The color is not threatening. And this is what a normal person's airway looks like.
It's purple.
It's usually a very nice pink color. I don't know whether it's baby pink or peach. I don't know those colors. You are the one who will tell. But it doesn't look like this in real sense. What we have done here is to try to show a very calm color. Okay? Now, when one starts having the inflammation, certain things happen. The airway becomes redder. And if you compare the caliber there and the caliber there, it's definitely narrower. With time, this area becomes thicker. And that thickening causes the airway to narrow even more. In the short term, the thickening is reversible, completely reversible. But in those people in whom asthma has persisted for long, that thickening persists. Now, when one has a very severe reaction, the narrowing is even worse. And you can see, if this is focused onto, you'll see that there are white things there. That is mucus. And this mucus can be so thick and tenacious that when one coughs, they can't bring it up. And indeed, some people die because of the blockage of the airway due to mucus and also the narrowing. And you can still see it's very, very red. That implies that there's a lot of inflammation going on. So basically, that is what brings on the issue of asthma.
Absolutely. And he said during, you know, guys are born with it. So are we saying it's genetic?
Thank you. As Dr. Aweru mentioned, when we say allergies, you're talking about people who are hypersensitive. The body is more sensitive than that one of other people who are not having an allergy to that thing. So why are they oversensitive? Because their genetic makeup makes them that way. So and the genetic makeup is inherited. So in a way, you are saying it is inherited. But there are many ways of inheritance in biology. There is a direct way in which, you know, one either born boy or a girl, which is, you know, very direct. That's not the case here. It doesn't mean that when you have got people who have asthma, all their offsprings will be having asthma. No, you may find that when you have someone who has asthma, if you trace in a larger family, you'll get other members of the same family with asthma. Not everyone, but some. Yeah.
So what happens? Does it skip a generation? Have you?
It's a complex thing because you know all the body tissues are mapped up by the genes. So and the way of inheriting them is very random. So but because they are all mixed up in that pot, then at the time of reproduction and now multiplication and cell division and all that, then you have some people will have more of those genes than others. So you may find that out of a number of children, I don't want to mention numbers, but you may find out of a family, some children are affected, others are not affected. Yeah.
I'm just curious. There's no environmental issue of how you bring up, let's say you're always smoking, that will make your child become asthmatic. They have to have the gene.
What happens is that those are triggers now. Things in the environment are triggers.
Got it.
Yes.
As we talk about triggers, let's talk about some of the symptoms and signs that you'll be able to see now. My child is asthmatic.
The obvious signs are the chest signs, the coughing, that it may be more early in the morning or more in the night or when it's cold or when they are running around or during exercise, or that's triggered by laughing a lot, or some factors are, will trigger that. That's a kind of cough that there is. Then this cough may also be maybe painful for some people who can say that, or maybe irritating. They cough until maybe when they vomit, or they cough until like they're clearing something from the chest, something like that. Then for those who can express themselves, they may talk of chest pain. They may talk of chest tightness. this is yeah. So those are the direct chest signs. If you look at their breathing, you may see it is disturbed. It is different from normal breathing. It will be a bit labored. They're struggling when they are breathing. Even when it's severe, you may actually find in the mild cases there may be no symptoms at all. Now here we're talking about when there are some symptoms. But then as they get severer, then it will even interrupt the speaking. It may even now make someone unable to talk or to breathe normally. And so that's the severity. That's on the chest alone. Yes.
What is normal breathing?
Normal breathing is you'll find that it varies from age to age. If you've got a newborn, they'll be breathing up at a fast rate, maybe 30 per minute. If you get the same child at 1 year, it will have come down to almost 20. If you get the same child when they're 18 years or 20 years or 30 years, they'll be breathing at much lower than that rate.
Yeah.
So normal breathing is the way you look at the way somebody is breathing. You can tell when somebody is breathing a bit faster than they're normal for the age, and more and with more effort.
Okay.
Yeah.
Dr. Munyo, I'm curious. Have you had someone maybe who never went through any triggers, and then now as an adult comes up to you and you're like, you're asthmatic?
Yeah, it's something we see frequently. It's not unusual to find someone who has genetic predisposition,
Yes.
but somehow has not been exposed to the specific trigger that they need to get an asthmatic attack.
Yeah.
And remember, the immune system learns. So this person may have been learning over the years. Indeed, I have had patients even in their 80s who are first time diagnosed to have asthma. Some of them may have had mild symptoms over the time of their life, but other people, for the first time, you find in their 80s, they come in, typical history, typical clinical findings, and there's a test we do which you call spirometry, and they score, and they are real asthmatics, and this is the first time ever that they are being diagnosed as asthmatic. Yes, it can start in adulthood.
Is this the same diagnosis you do for children?
Yes. You know, yeah.
You call it a spiro?
Spirometry.
Spirometry.
Yes, spirometry.
Yes, yeah. As Dr. Munyo has said, you have people who may present at any age. They can present as early as 1-2 years, and they can present as, you know, in their 5 years, 10 years, in their teenage, in their youth, or even in adulthood. So it can occur at any time in life. Yes.
Let's go to treatment. How do we treat asthma? And first of all, can you just ask a random question? This is not in the questions, but what's the size of our pharynx? What's the normal size of our pharynx?
Good question. Because depends with the age.
Okay.
It depends the age. We normally use the small finger, the little finger to show you the size of the trachea down here, the air pipe. And then on top of that, you can try to fit in now the visa or something that can fit in that.
Okay.
That would be where the pharynx will be fitting.
Okay.
So anyone, you can take the age as that, it's small finger to be their air pipe, the weed pipe, the equivalent of the weed pipe.
Okay.
And then on top of that, try to fit a funnel that can fit above that. That would be the
pharynx. So everyone has a different size. There's no standard size.
No standard size.
Okay, just checking. That was on the side. I'll tell you why. I'll tell you why later.
The triggers.
Yeah,
the triggers. Before we go to treatment, we could maybe look more at the
Please,
triggers,
because
if you're going to talk about treatment or management, there will be a bit about talking about the triggers.
Tafadhali.
So the triggers, they are variety. I mean, Dr. Monyo mentioned a number of them, but you can look at them in anything that would that anyone can be hypersensitive to. You can look at them as many of them may be irritant, like paint, perfume, soaps, detergents, anything that has a smell can be a trigger. Or it could be allergens, things that other people don't react to, and this person reacts to, which could even be food items, like cow milk or nuts, or could be mold.
So wait, you can eat nuts and get an asthmatic attack?
Yeah, you can.
Wow.
Yeah, you can. Yeah, they are all. You can be. It could be other things from the animals, like animal dadders, like cats. The fur from the cat, the dadders from the cat. Could be cockroach, whatever cockroaches are carrying around. Could be anything in that range. Can also be weather, extreme of weathers, very dusty, very cold. Sometimes even very dry, very hot. Can also be a problem, or can be infections, which is a common trigger. The flus, the viral infections mainly, they are common trigger. The common cold and among others, they cannot trigger, an asthmatic attack.
Okay.
Basically
And
that's
for
it.
this is for both.
Yeah, there's something else that
Yes.
we
Sure.
need to look at, and
Yeah.
these are the internal triggers. You know, he's talked nicely about
But
the external
yeah.
triggers, but there are also internal triggers.
Like emotions.
Exactly. You know, there are some people who, when they are very happy, they get an attack. When you make people depressed, they get an attack. Other things are things like reflux. This is where acid comes from the stomach, comes all the way up to the throat, and irritates the airway. That also can end up causing an asthmatic attack. There are also other chemicals within the body and cells which also can trigger. For example, there's a group of blood cells we call eosinophils, which if one has an excess of, can also trigger asthma and also make asthma very difficult to control. So they are both external and internal. Yeah, and stress is also a very important trigger for asthma, especially in adults. I don't know about children.
No, even children, yes, yeah.
They also get stress and
Yeah,
Yeah,
they
yeah.
start,
Okay.
yeah.
They can, yeah.
just so that I make sure the audience and I are together, because this is really, it seems really complex in a sense that it is a condition where your trachea
Breathing
gets,
system.
your breathing system
Yes.
gets inflamed,
Yes.
gets a lot of mucus that is caused. Is it a sign of your body trying to fight something to protect you? That's why you get it?
Is a reaction. It's an
reaction.
unusual response to
Okay.
all those things.
Actually,
Okay.
the lung has very few ways of protecting itself. And when the lung is irritated, it can only do a few things. One, it can close up to
Yes.
prevent further irritant. For example, imagine smoke. When one is exposed to unusual smoke, the airway closes up to try and prevent more smoke getting in.
Wow.
The second way is by coughing, trying to expel whatever is causing the irritation. And number 3 is production of mucus. This helps dilute or trap whatever is trying to go into the areas which
Absolutely.
are protected. So even when one has an asthmatic attack, the body is trying to fight whatever it thinks is an enemy and trying to get rid of it.
Before we get to treatment, the severity, the different levels, what are some of the things you can highlight? Maybe let's start with the children, then
Okay. Maybe look at when do you run to the hospital?
yes.
Because it's good classification to say mild, moderate, severe, or any other classification. But I think for the bigger audience out there is to know when is asthma.
Exactly.
We'd say anybody who coughs frequently or gets those signs we have talked about, they need to be seen. They need to see a doctor, then get diagnosed, and then be put on treatment. We'll talk about the inhalers and their use. And then those who are on treatment, then what you'd call severe is if somebody is coughing too much, disturbing their sleep, disturbing their normal life, or if somebody is struggling to breathe, breathing too fast or using too much effort to breathe, or if somebody is feeling too tight in the chest in a way that's already uncomfortable. If one can't perceive any of those, then that is severe enough for them to go and seek, even if they're on treatment, to go and seek treatment.
Okay, I'm curious.
But ideally, anybody who wheezes should get treated, because as we said from the beginning, some people may be having tightness without necessarily too much symptoms.
Yes.
So any symptom of asthma necessitates a good checkup and be put on treatment.
Our audience, what is wheezing? Because sometimes you've lived with this thing for so long and you don't even know, like, that's not normal.
Wheezing is a musical sound. It's a coarse sound that is basically like whistling.
Okay.
Like the way if you blow on a whistle,
Yeah.
that sound, or basically like
Yeah.
something close to that.
Yeah.
So it is when it is felt more when one is breathing out, then they would be making that sound, that whistling sound. That's, if you can listen carefully, it's more or less coming down from the chest. It's a little different from the one that would be coming from the nose.
Absolutely. And the question for you, Daktari, was, when you just highlighted and he even went into it, is there many other symptoms you can get that are not asthma? What are some of the things that also cause that chest tightening? And maybe just to...
Okay. Now, for some people, they may recognize wheezing. If you've got a cat and you pet the cat and the cat is very happy, there's that noise that the cat produces. That sounds
I've
like
never been
sometime-
that close to a cat. And I don't
Some
think
cats
it's going
are
to
usually
happen.
happy like that. So now, you have asked a question. And you asked what are the other things that can look like asthma. In the adult population, what we usually will make sure is not happening is, one, does this person have just a virus infection? And some of these virus infection Yeah, these virus infections sometimes can mimic asthma in the sense that they cause the same inflammation, and this person starts coughing, producing lots of mucus, getting chest pain, chest tightness, what people call bronchitis. You have to exclude the bronchitis, which is infectious, versus asthma, which is not an infection completely and therefore does not require antibiotics. It's an inflammatory condition. Of course, viruses can trigger asthma, so that distinction needs to be made. Secondly, heart conditions. When people have congestion within the chest, they will have heaviness of chest, chest pain, they'll have wheezing, they'll have all those things that we have discussed, cough, not able to sleep at night because they can't breathe well, and so on. So when one assesses a patient, that also has to be excluded. In children, virus infections are important. Foreign bodies in the airway, for example, a child was eating a peanut, it goes into the airway, it can go to an airway where it causes that blockage, and that whistling sound can start. The child will start coughing, we will start having difficulty in breathing. All these things must be thought of and excluded when one is assessing a patient who has got asthma.
Absolutely.
There are many others.
Okay. That's just some of the things. We just don't want you to mistake them, because you've said asthma is an inflammatory disease, while
bronchitis,
all these other things are just
other things.
Infectious.
Yeah, there are other things. Yeah.
As we talk about that, I'm just looking at us explaining what asthma attacks is, because I feel like we've referred to it so many times. What does it look like when one is going through an asthma attack? Let's start with kids.
Okay, asthma attack. When you say that somebody has asthma, they are not always having the symptoms. They are not always coughing or wheezing. So we say they have an attack when they suddenly develop the symptoms.
Okay.
If somebody was just well, then something triggers them and they start that cough, that wheeze, that chest tightness, all those symptoms.
So it's not necessarily the severe, it's just any part of...
They get an episode. They got an attack of asthma.
Okay. And in adults?
Yeah, I had mentioned earlier that asthma varies within the individual and between people. And what I mean is, an attack for one person is very different from an attack from another person. Some people will get attacks of chest pain. They'll never wheeze. Some other people will start coughing a lot, especially after they do a bit of exercise. They have a type of asthma we call cough variant asthma or exercise-induced. All these are types of asthma. So everybody's asthma is different at a given time and also over time. For example, there are some children who will initially have a lot of wheezing. Later on, when they are teenage, all they will have is a cough when they go to the field. And those are also mild asthma attacks, and sometimes they can be quite severe. So when one is looking at this person, all these signs and symptoms that you have talked about have to be thought about. This person was wheezing in childhood. At age 5, they stopped, and many mothers are told, oh, akifika miaka saba, they will stop, the asthma will go away. Now when this child is 13, 14, they go swimming, and then they come home and they're having chest pain, the mother does not connect that this could be asthma because it's pain, and they are used to a child who is coughing, producing a lot of mucus and wheezing.
Absolutely.
So this has to be borne in mind, that asthma changes within the individual and between people.
Absolutely. If you just joined us, I'm hanging out with two great people who have been on the show. We're talking about Dr. John Wachira, who's a pediatrician, and Dr. Peter, he has another name, Wachira Monyu, who is a pulmonologist. The conversation is on asthma. Keep your questions coming on 22232. I'm getting to your Facebook questions, so if you're watching on Facebook, you can go ahead and comment as we now go to treatment and management of this, because clearly I think what you've alluded to is that you grow with this thing, you have it, you're now treating it and managing it for the rest of your life. Is that it?
Yeah.
Yes.
Okay, let's talk about treatment now.
So as we said, people with asthma, they do not always have the symptoms every day of their life. It comes and goes. It's intermittent. So as a way of managing it, then one needs to learn themselves, look at what are the triggers, what things that trigger this cough, this chest pain, this tightness, and all the other symptoms. So, and one way of doing that, because we are talking about allergies, is avoidance. Then avoid those paint, perfumes, the soaps, the extremes of weather conditions, clear the dust. It's both a way of managing, because you need to remove that.
Absolutely.
So
even some carpets. I mean, these faux carpets, they're really and the people. There's actually a lady who recently just cleared her whole house of all the faux carpets. I mean, she left the Persian rugs and all this, and life was great.
Yeah, carpets can have a lot of dust. So can mattresses. and the
Wow.
b- and the beddings, the duvets and the blanket. All those can harbor a lot of dust. Even the clothes that we do wear, when they have not been used for a long time in the wardrobe, they harbor a lot of dust. They can even grow mold. Even the shoes, for people with many pairs of shoes, they can also have, when they're not used, they can harbor a lot of dust and even mold. So all those can be things that can actually trigger or just make this person continue coughing throughout. So the first part is to identify or just generally just remove all those and control all those possible allergens, because you may not be able to test. So that is one. The second thing is get a good evaluation and good assessment. Most of the doctors, as Dr. White mentioned, is they may, if it is people who can blow, who can do spirometry and all that, they'll check on that. Most doctors will just use a set of questionnaires, a set of questions, and then from that they can actually deduce and say this person is asthmatic. So then the one needs to be assessed. Few times they can even be done testing. They can be done, some lab tests to check which what substances cause allergy to this person. Because then that will guide the treatment. Because being an allergy, there is no cure. The main thing is try to avoid what triggers it. Yeah, so that is basically what one will be looking into.
Okay.
Yeah.
Anything you'd like to add?
Yeah. In terms of treatment, we do the environmental cleaning. Very, very important. You find some people have dresses they won during their wedding in 1987 still hanging in that cupboard.
Please, let it go.
And shoes which the husband brought from Tanzania in 2006. Let it go. Now, after that, then we go to the medication. And the key thing to take home here is that treatment of asthma depends on the symptoms. So when a person has no symptoms, a time can come when the doctor will tell you, please stop your medication, and we wait, because it will come back. Let's wait. But when a doctor is assessing you, we usually will grade a patient at several grades. There's the patient who has very mild symptoms which are rarely there. That one you can treat as and when the symptoms come. On the other end of the scale, there are patients who have severe symptoms in whom you need multiple medicines and maybe multiple times to take in a day. But for majority of the patients, they will require inhalers on a daily basis. The dose of the inhaler will depend on how their symptoms are. The doctor will increase the dosages as the symptoms worsen and reduce the dose as the symptoms worsen. And these are some of the basic inhalers that we have in the market.
Yeah. I think all of us have owned one of those at some point. I don't know why. It's like a season where maybe I had an inhaler, man.
It's because it's a very common condition.
Okay.
Very common condition.
Okay. Even as we go to that, maybe some of the questions that are coming in over here is, after how long can I stop using an inhaler after I've not had an attack, the preventive inhaler?
Yeah.
Someone is asking that on Facebook. Thank you, Alison Kirinya. Thank you for watching.
Yeah. Usually what we will do is we start at the dose where the patient is. If a patient has not had any significant symptoms for between 2 to 3 months, this is in adults, between 2 to 3 months, then we can reduce the dose of that medicine. Wait another 2 to 3 months, reduce again if the patient is still not having any symptoms. At the end of that reduction, the time will come when the next reduction is zero medicine, and therefore that person can stop. So it is not easy to say that you will use your medicine for 2 months or 6 months or whatever. It depends on how the person is responding to the dose, whether they are getting symptoms, and you gradually reduce the dose. One problem I find frequently is when patients end up in a pharmacy with a prescription, the pharmacist will tell the patient, and this medicine is for a month, because the doctor has written for 1 month. And therefore, at the end of that month, you find the patient has stopped using that medicine. And of course, they'll get the attacks again. Please, let's continue the medicines until the doctor and ourselves have agreed that it is now a good time to reduce the dose or to stop the medicine.
Okay.
Yeah.
Absolutely. Maybe you can answer this one from Picture, who's asking, how should someone take a Symbicort inhaler for? How long should someone take a Symbicort inhaler for?
I think... thank you. I mean, inhalers, you can group them generally into just 2 main groups. You have the one that's quick relief. There will be many colors close to blue or green. But
I even saw a pink
countries. One. This will be the quick, for the maybe the quick relief, the salbutamol and other with that MOL or OL. So there will be maybe bluish, greenish, and there may be other colors in other countries. Then there are those that are long term that may be for prevention, which may be now the pink the brown, the purple, other different colors. That's in our market. That's what we mainly find. So the Symbicort falls more in this allowed this group. That's more for prevention. And as Dr. Virus mentioned, how long one uses depends on how the symptoms are behaving.
Okay.
Yeah, and the best way, or when somebody is on any regular medication, there should be under guidance of a doctor or a health advisor who can tell them do this. But on the minimum, you're talking about few months.
Okay. I see Sarah Atieno Nyaroganda. She's asking what causes an increase in EOSI and
eosinophils,
especially in the case where full hemogram results always shows
that one.
The word is range above normal ranges. How can that be managed?
Okay, I think I can tackle that. Eosinophils are a family of white blood cells. If you remember,
you mentioned.
Yes. There are three main cells within the blood. There are the red cells, which carry oxygen, hemoglobin, and so on, amongst other tasks. Then there are the platelets, which cause clotting. Then the final group is the one which is involved with immunity. And these are the white cells, and there are several families. The one called eosinophil is generally a cell we associate with allergies and also fighting certain types of infestations and infections. Now, when one has high eosinophils, because they produce chemicals which react to things like allergies, they can find that they have the eosinophils are high, and that can create a problem with recurrent asthma, and there are specific medicines for that. But eosinophils can increase due to many other conditions, including worm infestation in the tummy, in the intestines. Some type of cancers can behave like that. Sometimes some people with long-term allergies can also have those. So when one has a high eosinophil count, it's important for the doctor to assess that person. What is it in this particular person that is causing these cells to rise? Not necessarily asthma.
Okay. Okay, the eosinophils. That's it, correct?
Yeah.
Aki, my teacher didn't teach me that one. I listened. I loved biology so much. I know the white blood cells. I know it as well. We'll be right back to answer some of your questions. Keep bringing them on Facebook, on Twitter, on Instagram. Keep interacting with us. Share this video with somebody. This is what we're talking about, making sure that you are informed and you can take care of yourself better. We brought you great professionals. I have paid for all your consultations. So if you go see them on your own, my friends, it's like your meal for like 3 weeks. But here, it's free. So go ahead, ask all your questions. Dr. John Washira, who's a pediatrician, thank you so much for joining us. And also Dr. Peter Munyu, who is a pulmonologist. I'm sorry for saying the name Peter, but it's just stuck. We'll be back to answer your question. Vicky, who's asking about allergic rhinitis contributing to asthma, and you had mentioned, but we'll answer her. And we'll be right back. This is Health Check. Keep it right here on Hope TV. It's the only station where you look and live. My name is Kerry Kagiri. See you shortly.
Every time, every single minute, there's something new to talk about.
The government continues to make sustained investments,
and we want to completely support.
Since late last year, the coronavirus COVID-19 has emerged as a serious healthcare threat. This is an infection that has gone global and none has been spared. The government, through the Ministry of Health, has put in measures to keep Kenyans safe against COVID-19, which is currently rampant around the world, with new confirmed infections and death cases daily. Such sanitization and screening of visitors at this border post and across every entry point in the country is very vital in preventing the spread of the disease in the country.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
It is scary that a single cough here can lead to an outbreak of epic proportions. In order to prevent that, the government has instituted measures to keep Kenyans safe.
The facility has all the equipments you need, from handling a basic patient up to ICU setting.
However, you also have a role to play in preventing spread of infections.
Citizen responsibility is the key to the success of this initiative and these measures. Let's all do what we have to do individually. And this is how we are going to defeat this disease.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
Always ensure that nimefanya proper sanitation ya mikono. Every time na board matatu, lazima ni sanitize mikono.
We have faced many severe challenges as a nation, and we have always found a way to rise above them. COVID-19 is no different, and we will overcome the pandemic. Stop coronavirus. Follow all directives from the Ministry of Health. Wash your hands properly.
Welcome back and thank you for watching. I love this. Esther in Utawala, how are you? There's a special place in heaven for you. Esther is saying, thank you very much, Kerry, for paying these consultants for me. I got you, girl. I got you. If you just joined us, you are on Health Check. It's on Hope TV, where you look and live. My name is Kerry Kagiri. The conversation today is on asthma. You've had this word thrown around. Today we've discovered the condition, and I'll ask our pulmonologist, Dr. Munyu, to just explain to you one more time what goes on when you have and if you have asthma.
So when one has asthma, the key thing is that there's something that gets into the airway, and these are things that we breathe in. And what happens is, if I may use this again,
sure.
Initially the airway looks nice and quiet. The issue color, as I mentioned earlier, is a nice pink. But once there is something that irritates the airway, there's a process which is called inflammation. And the inflammation leads to the following things. One, there is thickening of the inner lining of the breathing system, and it becomes very red and swollen. After that, there is further thickening with more severe attack, and there's production of lots of mucus. What the thickening and the mucus does is make the airway quite narrow, and that's why when people breathe, they're having difficulty in breathing, they're having pain, and they're wheezing.
Absolutely. And there's something you mentioned about the length of someone. Did you say, I don't know what the medical term is, but the longer someone takes without seeing a doctor, the severity is worse in terms of they've not been managing it. This is how you can manage it when you realize early and you get help early.
Yeah, what happens is, if the inflammation continues for a long time, the narrowing and the thickening, which initially was just short term, becomes more and more long term. And therefore, a person who has had poorly managed or poorly controlled asthma for a long time will find it much more difficult to benefit from the medication quickly compared to one who has been properly managed.
Absolutely, and that's our pulmonologist. He has great information. But we do have a pediatrician in studio, and the question for you, mostly from parents, is how do I know if my child has asthma?
Okay, the main thing is seeing a recurrence of cough that is worsened by certain conditions. The commonest is a cough was at night or early morning, accompanied with sometimes wheezing, sometimes difficulty in breathing. And the team seem to be going away much of the daytime, or when it gets warmer, or when the conditions change. That is what you'd see. Below the age of 5 years, there are many conditions that can cause wheezing, and the commonest is viral infections. So it's not every child out there who is wheezing who is asthmatic.
So they must come for diagnosis.
So it's good for them to be seen in a hospital. But if somebody is coughing, wheezing, chest tightness repeatedly, you know, after a few days or weeks, then they get the same condition, they are most likely asthmatic.
What are the risks of using cough syrups to treat asthma?
As Dr. Munyu said, asthma is an inflammation condition, and therefore the main treatment is focuses on treating that, managing that inflammation. And most of the medicines we are talking about, they are either trying to reverse the three effects that he talked about: the tightness, the mucus, the thickening. So the most cough syrup do not have that effect. And then out there in the market, the cough syrups that are there, many of them have got effect on the mucus. They either make it thick, they either make it, maybe try to make it more break it to become more loose and all that. Especially in children, if one carelessly uses the cough syrup, then they end up clogging them more with the mucus because they can't cough it out. So they're just breaking down the mucus is just clogging down the lungs. So that
which can kill
things.
them.
Yeah, which is not safe. So
Okay.
the other one is an anti-cough. Basically just trying to block the cough reflex. The cough, as Dr. Monyo said, the cough is a reflex. It's a protective way. That's how they try to cough out, to get something out. So when you just tell them stop coughing, it's like you're holding their chest telling them stop coughing. So when one carelessly uses a cough syrup, then they can have that effect. I would say anybody who has that recurrent or repeated or coughing, wheezing, chest problem should get seen and ideally be put on inhalers. Inhalers are the commonest medication that are used for the asthma. There are many other medicines that are used in the hospital settings, but the commonest are the inhalers, which can be used even at home when people get the attack and when they have the symptoms.
Absolutely. Let's talk about using it at home. And you have many people, and sometimes it's boring. You want to share your inhaler. To me, what is asking here on the text line. This is something I've actually done. Because you're curious. You're like, Mama unafanya? Okay, fanya tu. Oh, my mom didn't do that. Okay. Why is it wrong to use an inhaler if you're not asthmatic?
Generally, inhalers are used by asthmatics.
Yes.
But there are certain other conditions in which inhalers can be used.
Okay.
For example, there's one called chronic obstructive pulmonary disease, which behaves similar to asthma, but it's really not asthma. And the causes are different. So in that condition, one can use inhalers. There are also people who may benefit from inhalers in the short term, even when they do not have asthma. For example, if one has the condition we have talked about called bronchitis, so if one has a condition which leads to the closing up of the airway, then one can help that person by using an inhaler so that the airway stays open. Other conditions where the airway is narrowing for whatever reason, whether it's lung getting scarred or getting too much mucus production, in those particular conditions we use inhalers. But by and large, maybe 95% of the people use inhalers mainly for asthma and COPD.
Okay, COPD you said is?
Chronic obstructive pulmonary disease. It's a common condition in people who smoke or people who live in smoky areas, like our mothers who have cooked in smoky kitchens for a long time.
Wow. Yeah. Okay, absolutely. As we talk about that, what is asking, I was using inhalers sometimes back and I stopped. Now I wheeze and I'm not on any treatment. So, what is your question? But really, they need to get back on it.
Yes.
You answered me.
Yeah, Dr. Kerry. It's infectious. Dr. could you please show people who need to use inhalers? I mean, for all the people who are watching this day, how do they use inhalers and what are these other gadgets over here?
Okay, as we said, the asthma is a disease affecting the airway and mainly the lower airways. So the inhalers are special gadgets that pack in medicines in here. So for delivery into the lungs, into the airways. And when you use a very small amount of the medicine, you're using it in micrograms. The same medicine, if you had to use it to get to the lungs, in syrup form or tablet form, injection form, you'd be using it in thousands of micrograms. Wow. These would be in hundreds of micrograms. So that's why they are specially made like this. And then when you use the inhalers, the medicine just goes to the lungs. They don't very little of it goes to any other part of the body. So the side effect will be much less. Okay. And therefore, it becomes safer to use inhalers for a long time, even for months, sometimes even for years, if needed, as opposed to if you take the same medicines through the mouth or injection or any other method. So that's why the inhalers have been developed worldwide over the years to help people cope with asthma or similar conditions.
Did you know?
Yeah, so that is why the inhalers are done like that. So in here, is a medicine, it's not mixed up. So for one to use it, then they would need to deliver it to the lungs. So the old way was, I mean, not let me say the correct way of doing it.
Please.
The correct way of doing it is, particularly in children, I would say below 12 years. Below 12 years, then the way they would do is they would have an inhaler, which is in there, and then they would have a spacer. The spacer will be as per the size of the nose face region. So I guess this would be my size.
Okay.
So the idea is to mix up this medicine, then spray it in here, then breathe it through here. So you would I'll do it. I'll repeat twice.
Sure.
So so you need to shake this medicine, mix it up well. So you mix it. You just shake a few times, like 5 times or so. But nice shaking. Then you open up the cup. Then you have this well fitted. Then you fix that in there.
Okay.
And then once you have done that, then in children you'll be giving this to a child.
Okay.
But if you're doing it on yourself, then you'd be putting this over your nose and mouth, so that because it covers your breathing area. And then in that, then now you would push in here, and then now breathe in and out like 10 times to make sure that you get all the medicine in. Then you use a number of puffs that you have been prescribed.
Okay.
You can use many puffs of this. If these blue ones, the salbutamol, you maybe have been told to use 2, 3, 4, 5, 6, 7, depending on how your response is. So you use that. So that's how you'll do it.
Okay.
So the reason why you use this spacer is to help the medicines get into the breathing system. If you tried using it directly, much of it will just be spraying your tongue or your palate or inside your mouth. So it may be hard for you to breathe all this medicine in. And again, you need to coordinate very well between when you push this down and when you breathe in, which is very hard for most people to coordinate. Therefore, this helps you that when you spray the medicines in here, the medications in here, then you'll breathe in, and you'll breathe it in slowly, and you'll get much of it in the in here. And that's how you'll do it. And there are different spacers for different ages.
Okay. That's interesting. I've never seen a spacer.
Dr. Monyo can also add something.
Sure.
In adults, we can actually train one to just use an inhaler device.
Yes.
And the way one would use it is, first, make sure it's the right medicine for the right reason. For example, if you are taking the medicine for relief, you'll like the blue one.
Okay.
If you are taking it for regular use, then you can take the other type. So then you open, make sure you open. Sometimes it's a bit tricky when you try to open like that, can't. So you open from the side and it's much easier.
Okay.
Then once you've opened it, shake. Then in adults, you breathe out completely.
Okay.
So that you create some space for the medicine to go in.
Okay.
Let me just demonstrate.
Yes.
So breathe out completely through the mouth, because if you breathe out through the nose, and you can try this experiment even now, you breathe out less through the nose and much more through the mouth.
Okay. And then breathing you breathe in more through the nose.
It's all the time is through the mouth. Okay. Yeah. Okay. So you shake, breathe out completely, put it in your mouth, and put your lips all around so that your lips hold it like that. Spray, and immediately, as you were saying, coordinate that you breathe in deeply. Please breathe in through the mouth, because if you breathe in through the nose, the medicine is in the mouth. So breathe in deeply through the nose. Let me just show you. I'll put it here, but please put it in the mouth.
Okay.
So breathe out completely in the mouth, spray, and then take a deep, full breath through the mouth. You may leave this in your mouth and breathe in through it, or you take it out and breathe in deeply. Then you hold your breath. You count slowly in your mind up to 8 seconds. And the reason you are counting slowly is because you need the medicine to move right down into the different branches of the airway. If you breathe out immediately, the medicine would have just gone down and you breathe it out. So take a deep breath, hold it in, and count slowly up to it. If you need a second inhaler dose, you don't do like that. You first shake, take the first one. Take a deep breath, hold. Then breathe normally. Then shake again, breathe out after waiting for about a minute, then spray the second time.
What if you're having an attack? You know, sometimes it's like a 911 emergency.
Yes, it's still the same way. Because even if you pump 5-6 times, if it is not going down into the airway, then it's just wasteful.
Absolutely. Dr. was telling me about someone who, he told him shake well before use. He shook himself.
So as you can see, it would be very tricky to tell a 2-year-old or 3-year-old to do
very
that.
tricky.
That's why the spacers are coming, and they're very important.
But we are also finding more and more adults like using spacers.
Yeah.
Especially now that we have spacers which are not bulky. You see, like this one, you can collapse it and it can fit in your bag.
That's true.
Okay, and you do not, in adults at least, you do not need to carry this. You can just use it directly. If you're feeling posh and want to carry this in your bag.
Fancy. Okay, absolutely get it. You brought this up and I remembered something called nebulization. Who is that?
Nebulization is a relative of this.
Yes.
Of these spacers. What you're doing is that you are again you have the medicine in liquid form, then you pass it through an equipment called nebulizer that makes it turns it into a gaseous form.
Okay.
And then now one can breathe in and out again using a mask. There will be a mask connected to it.
Okay.
So the nebulizer is just an equipment that will have the same medicine but now in liquid form, then passed in through that equipment, then it is vaporized into gas, and then now one can breathe in and out that gas into their lungs. So something a similar process, only that will be a bigger gadget many times and would need power if it is electric, or may need to be driven by oxygen in many times in the hospitals. There is a place for it maybe in some very sick people who may not be able to coordinate all these, but the inhalers, the spacers and the inhalers directly are equally useful, and they can relieve most of the asthmatic attacks. Yeah, I mean, country by country people may have their own preference, but these ones are easy to carry around. And the inhalers are, you can put them in your pocket and you can use them anywhere, and they are life-saving.
There's another inhaler I saw which is round with a red part, I think.
There are many gadgets. There are some that are actually round with powder in
is
there.
Is it in the same categories as those?
It will be in the same categories as these ones.
Absolutely.
Yeah, the ones for long-term use.
Okay. Okay. As we look at that, probably many guys have been asking, what causes loss of platelets? Could you respond to that? That's Mwanzia in Tudo, Mombasa. And if you just joined us, the conversation today is on asthma. We're talking about that disease that can make you stop breathing and actually get you a lot of mucus and clogging in your chest. That's a basic way I can explain it. I hope I've done justice to the layman who's watching. So, loss of platelets.
Now, platelets is one of the 3 components of blood that we had mentioned. There are red cells, white cells, and platelets. And when we say one has low platelets, it's because when you check the blood, it has a lower number than normal. In adults, the normal number is 150,000 to 450,000. That's generally what we say normal. But sometimes you do a blood count and you find the patient has 10,000 or 20,000 or something like that.
Wow.
And therefore that person has a low level of platelets. So why would one have a low level of platelets? And I would basically say there are 3 processes. One is when the bone marrow, which is where blood cells come from, is not producing enough of them, either due to diseases or due to chemicals which have gone into the body like chemotherapies and so on, or even radiation. Now the second group is where these cells have been produced from the bone marrow, but they are enclosed in certain structures within the body. For example, there are some children you find they have a very big spleen and all the platelets in the body are going there. Or the third process is where they are getting lost, and the loss can be internal or external. The internal loss is where they are getting destroyed much faster than they are being produced. For example, when we use certain medication, the platelets which are already formed can get destroyed through various mechanisms. Or someone who has had massive bleeding, they can all be used to try and control or make a clot. And therefore, when you do your blood test, you find that they are less than usual. Or a person has bled so much, we have given him some fluids to try and return the fluid volume, and that has diluted them. So basically, quite a few processes that can cause that.
I think I really like medicine because all these doctors have had to go through entire medicine and then now into specialization. So you guys can be able to respond to so many kinds of questions. But let's keep it towards the questions on asthma. One here is asking, Daktari, how do you treat bronchial asthma? And what is bronchial asthma?
To make things easy, asthma is asthma.
Asthma is asthma.
Yeah.
Okay.
And so all the things we are talking about the airways.
Okay.
And they affect the same airways. So that is asthma.
Okay.
Yep.
So everything we've talked about,
we'll apply.
Copy paste. Copy paste. And what you can do is you go ahead. If you missed the video, go ahead and watch it. Let's pick more questions. Some of the questions are a bit repetitive to conversations we've had, but we are going to respond to you. One here, just venting. Elsie Paul Sana. She says, I hate asthma with a passion. I've had it since I was 10, and maybe realized it at 10, because what we've discovered is something.
Let me try and reassure her.
Please.
Asthma is a very good condition to have. Actually, research has shown that asthmatics tend to be very intelligent people.
Oh.
If I may give a few examples
Sure.
of people who are very intelligent, you know Clinton.
Yes.
Clinton is an asthmatic. Someone like this guy of the nuclear bomb, what was his name? E is equals to MC squared. What was his name?
No.
That gentleman. He was an asthma. Einstein. He was an asthmatic. Which other company do you want to be? Your doctor here has asthma. It hasn't stopped me from doing anything. Gebre Selassie, the marathoner. I hear many people saying, oh, I have asthma. I can't exercise. I can't do that. That gentleman is an asthma advocate.
Wow.
Which other company do you want to be in?
Okay, so be encouraged.
So the key thing is identify it for what it is and treat it with respect.
Absolutely.
Take your medicines, do your follow-ups properly, and you live a full life. Yeah.
Elsie, I won't even continue with that topic. I hope you've been affirmed. Let's just leave it right there. We were talking about Vicky Zoe's question, which was, can allergic rhinitis contribute to asthma? You can just go ahead and repeat on that. And also, can you get asthma at a later age? So we can start with you and then carry it on to the next.
Yeah, the first question about can allergic rhinitis cause asthma? We said asthma is allergy, and it affects the airway. And the airway is all the way from the nose to the throat, to the air pipe down to the lungs. So allergic rhinitis is the same part of the airway allergies. It's not a cause, it's just part of the allergy of the airway system.
Okay.
So people with asthma may also be having allergic rhinitis, the nose blockage. They may also be having what people call sinuses. Actually, they may also be having allergies of the eyes. They may also be having allergies of the skin. They may also be having food allergies. So all those it's just their genetic makeup that makes them more sensitive to things that other people will not be reacting to.
Absolutely. One is asking, KKK, great show. Thank you for watching, Alex. Saying, have the consultants seen patients recover fully from asthma and allergies?
We said allergies are genetic conditions. So it's not so much of full recovery. It is managing what is causing it. So if somebody knows that they are oversensitive, you know, in the rural areas, people know that when I go to Napier grass area, I'll get an attack, I'll get a wheezing and a cough. Then they avoid that. Then people know that if I avoid these smells, some strong perfume, then I'll avoid that. Then they'll have fewer signs and symptoms of that. So they are managing the triggers of the asthma.
Absolutely. Okay. If you're not adding anything, let's talk about Nyambura Nyaga's question. Just got diagnosed with asthma 3 months ago. My question is, should I use my inhaler if I don't feel chest tightness?
The decision to use or not to use the inhaler is usually a shared decision between the patient and the doctor. But the basic decisions are dependent on the patient's symptoms. If the patient has had no...
just continue.
Yeah, so
sorry.
Depending on how the symptoms are, if the symptoms have been gone for several months, then one can start tapering and reducing the dose of medication.
Okay.
So it's something that she should discuss with her doctor so that they decide when can she start reducing the doses and when to stop, if at all she'll get to stop.
Okay. Doctor, someone's asking, where can I get spacers?
The spacers are found in the chemist. They're just part of the same medication that are used for asthma and other conditions. So most chemists will have the inhalers, they will have the spacers. But if one can't get in the nearby chemist, they can look at the hospital chemist. Most hospital chemists, nearly all hospital chemists, will have the spacers.
Okay.
And the good thing with the hospital chemist is that they'll have the appropriate one for the age. They can actually advise that. But any good pharmacist, even out there in a in a little chemist, they can also advise on the age as well for when the ones selecting the spacers, because we said if one is just let's say above 6 years, then they can actually use this direct without using a mask, and they can just blow over there. And then if they are if they are bigger, maybe around 3-4 years, they can use that. If they are smaller, then they would need a more tight fitting mask. So the selection can be guided in the hospital chemist or by the pharmacist or in the chemist shops.
Just have to make a warning. This thing looks like some things other people who are not sick use to inhale some other things. Do not try this at home. Do not. Someone is asking this question. We've answered it, but let's answer again. Difference between asthma and bronchitis.
These two conditions affect the airway.
Yes.
If you strictly look at bronchitis, it's affecting the part of the airway we call the bronchi. Asthma also manifests in the same area. The driving force for both of them is inflammation, but the triggering mechanisms are different in that in most cases of bronchitis, there is something which does not cause allergy. Things like smoke, things like infections, virus infections, and so on. While in asthma, the driving force is an inflammation, or the airway is reacting excessively to something that is either breathed in or coming in through the bloodstream.
Absolutely. Henry Nzama is sharing with us his history. At age 27 in 2018, after being treated for a long time without healing, I was discovered to have asthma. I took medication for 3 to 6 months, got well, I was told to stop. I was shocked to be told I had asthma. So what he said, when should I go for another checkup and after how long? And sometimes he experiences some chest pains and they go by themselves. Also, where can he get a specialist? They're not very common in government hospitals like the one I used to attend. Pulmonologist, mko wangapi Kenya?
We are around, now we are more, maybe approaching 40.
Okay.
So there'll be more and more in the public sector. And they are there actually in some of the hospitals. Now, as we mentioned, asthma varies within the individual at different times. So these things is calling chest pain. Probably those are asthmatic attacks as we have discussed. Maybe he used to cough and wheeze before, but now it has evolved and now it's causing pain. And the time to see a doctor, actually asthma is one of the main conditions we are taught in medical school. So any good clinician, whether it's a clinical officer or even a nurse or a doctor, should be able to advise him wherever he's coming from.
Absolutely. Let's go to YouTube. Thank you for asking your question on YouTube and for watching us. Please share this video, like, share, and subscribe to our channel if you haven't. Mulan is asking, hey, I've had asthma for 30 years now. I'm currently on Foralin 400 and I'm not sure when to stop taking it because I'm scared of going to the hospital with this COVID-19. Dr. Waweru, can you advise?
Yes. Now, it's nice that you are still using your Foralin 30 years down the line. And what this should go out to the other people is that you can use your inhalers for a very, very long time and safely. And this gentleman has managed to stay out of hospital during the COVID era because he has been using his medicines properly. So he's to be encouraged. Now, in terms of when to stop, he has used for 30 years. It is his doctor and himself who will sit down and decide how are your symptoms. Is it safe to reduce your dose? And if it is, then they keep reducing over the next few months and he can stop. But remember we said asthma is a recurrent problem. So if you disturb you this time, stop. Disturb you again, stop. So we cannot say that you have a time when you can tell a patient you stop your medicine at this time. You can only reduce. Sometimes you'll be off, but we know it will recur again.
Okay. Dr. John, swali hapa ni another question. What would you say about general practitioners who give Ventolin inhalers to children who are coughing? Is this the right approach?
I think the inhalers, if somebody is coughing or wheezing, it's good to just use and then see the response to that. Below the age of 5 years, there are many children who cough and wheeze from bronchiolitis. That may be a viral infection. And when you use an inhaler, there may be no response. So if anybody giving an inhaler to a child, need to reassess and see whether there is some response. Again, when if they're not responding, then one need to look at how are they using the inhaler or the spacer. Because the commonest cause of failure to respond to inhalers is inappropriate use or improper use of the inhalers or improper use of the spacers. So I think, as Dr. Vairo said, most of the medical schools and nursing schools, and they do and medical training colleges, they teach people how to use inhalers. So I believe the nurse, the clinical officer, the doctor out there, a general practitioner using the inhaler there has enough reasons why they want to try that inhaler even in the child.
Okay.
But the key thing is they need to reassess and see the response.
Okay. So it's okay, but with reassessing and seeing the response. What's the difference between asthma and COPD?
Now, asthma is an allergic reaction, while COPD is a long-term destruction of the airway and the lung after exposure to certain things. Things like smoke in people who smoke. Infections like TB can also cause COPD. And there are also genetic conditions which lead to people to develop COPD. Generally, COPD is found in the elderly or people who are past a certain age, while asthma can start even in childhood. It's very rare to find COPD in children.
Okay. This is the conversation on asthma. I think just knowing that, number one, it's inherited. That's something that's huge, and I've seen so many questions on that, and we had responded, and that's why I'm just going straight to it. It's inherited. Some of your questions on call, you can go ahead and keep calling us. The number is right below the screen. I'm hanging out with two specialists, Dr. John Washira, who's a pediatrician, and Dr. W. Munyu, who is a pulmonologist, and responding to all your questions on Facebook. Now, there's a very controversial question here, and I just want us to go through it. To you especially. One is asking, both of you, do you believe that asthma cases are spiritually induced, or is it all scientific every time? Are there some people who are miraculously healed from asthma?
I think that's a complex question.
It is.
I'll go to the last bit. Are they miraculously healed? Okay, healing, there are many ways of healing. God heals, and God can heal miraculously. That's the part. There's God heals any condition, whether it is bacterial, viral inflammation, or cancer in the condition. That's one. The first part, whether it is spiritual, I don't know what you mean by spiritual, but basically asthma affects the body initially. Then the emotions get carried on, and the spirit is part of it. So the whole person is affected, the body by the spirit. So fine, yeah, there is a spiritual aspect to it.
Absolutely.
So they need to get proper. If one is having the asthma, then they just need to find out what are the triggers to this. Avoid those triggers, and then avoid the triggers as they are, and then get their regular inhalers and use them well. And even as they seek God for healing.
Any effects of the inhaler? We said number one, it goes straight to the lungs. So someone is asking, does it affect the heart or the lungs? But even as we talk about that, are there any side effects as we go to it? And just a very shameless plug, just because you talked about God being able to heal, this Friday evening at 9:45 p.m. right here on Hope TV, on Hope FM, across our social media channels, we're going to have the Hope online Kesha. So you better join us. The theme is He is Able. And I think when you just mentioned that, I just thought, you know what, guys, this is an opportune time to invite you. So come hang out with us as we do that. Okay, let's pick Justus from Nyamira. We're coming to your questions. Justus, good evening.
Evening to you, please.
Thank you for watching Health Check. What's your question?
I have this regular pneumonia attacks on my lungs. Yes, very painful, a lot of pain on my shoulders, protruding to my lower lip.
Wow.
And I also have a lot of mucus production.
Wow.
Now I'm asking the doctor, the pulmonologist, is this asthma or is this the other disease that they have talked about?
Okay.
Now, there are many conditions which can behave the way you have talked about. And for us to know exactly what it is, we need to find out more about your previous health, because there are conditions like TB which can destroy the lung, and one will have recurrent infections within the lung. Indeed, there is a condition we call bronchiectasis, where the pathway through which air passes are destroyed, and they keep getting infections because the mucus is not flowing properly. Asthma also can behave in a similar manner in some people. Conditions like other infections can behave the same. So we would need to know a bit about his past history. Secondly, we would need to do a few tests. Basic tests like an X-ray of the chest will show us whether there is pneumonia or not. There are many people who have been told they have pneumonia, while indeed they did not have pneumonia, they had other things. So a chest X-ray, and it's available even in Nyamira where he comes from. He could see a doctor there, they take a good history, they narrow down the number of conditions that he could be having, and they do a simple X-ray and see what does this X-ray show, and therefore be able to advise better.
Okay, so just get support. Asking any natural remedies for asthma?
The remedies for allergic conditions is avoidance. So identify what is triggering it and avoid that.
Absolutely.
And then, of course, I would carefully say this, that children who are breastfed well, they tend to have better immunity, and they tend to cope better with even conditions like asthma, and they tend to have fewer episodes. Even when they have the asthmatic, they have less attacks. That's that. And even people who eat well, drink well, and are living healthy, their body will be strong enough. You're talking about inflammation and that kind of response. Again, natural remedies, avoiding. We talked about smoking and other things that would be affecting the body. So they can actually avoid smoke and such conditions. Yeah, so there are many things that one can do naturally without necessarily using it. Yeah. Okay.
I should have invited you for breastfeeding week. It was so good. What did you do about it? Did you celebrate? No, because you're passionate about that. I mean, as a pediatrician.
Yeah, no, the week is just for awareness. It's just for awareness. Yeah. It goes on from birth to about as long as mothers want to do it.
Absolutely.
So we mark it every day.
Okay, great, awesome. Even as we do that, actually, everyone's asking, where do we find a pulmonologist? Where can they find you?
Okay, I work in different hospitals.
Yes.
I run a clinic at the NPSHA on Tuesdays.
Yes.
A clinic at Nairobi Hospital on Thursday. And I have my own office in Parklands, so one can get me there.
Absolutely, yeah. On demand, my friend. Question is, everyone wants to consult personally with a pulmonologist. Okay, you're going to get it. So, do you have any other addition to the natural remedies? Because now we can't breastfeed,
No, unfortunately, what is happening nowadays is that everybody is claiming everything is working. I'll talk about chamomile. What is chamomile? Is it a herb or is it a type of bird?
It's so calming. I love chamomile.
Yeah, so others will talk about lemons. They'll talk about all manner of things have been said to be useful in these things. What I would say is most of these things help, but they may not be the number one go-to solution. Get the diagnosis properly done, and once the diagnosis is done, have the right treatment. If you opt to use all those other things, so long as they don't cause harm.
Absolutely.
Yeah.
Okay, Violet in Kitale, good evening. Violet.
Yes.
Thank you for calling. What's your question?
Swali yangu. Naulizia, okay, mimi nakuwa na problem kukiwa na baridi. Hello?
Yes, tunakusikia vizuri.
Kukiwa na baridi. Hello?
Endelea tu, tunakusikiza.
Mapua inafungana. Alafu ninakuwa na irritative cough. Ina irritate, yani unasikia tu inakuchokora mpaka unasikia tu umekohoa non-stop. Alafu baadaye unasikia hasa lungs hivi yani ni kama iko na pressure fulani. Sasa sijui hiyo ni asthma ama ni allergy tu ya baridi, cause ikiwa jua wakati ya jua sina hiyo problem, lakini wakati wa baridi nasikia ikiwa inanitoka, yani kuna kitu tu kwa koo hapa ina irritate tu hivi na kuchokora mpaka unakohoa.
Okay.
Yes.
Okay, tutakujibu Violet, asante. But it's good she's identified her trigger for the coughs.
Kulingana na vile anaeleza, kuna uwezekano mkubwa kwamba huu ni ugonjwa wa pumu. Kwa sababu vile anavyoeleza, wakati kuna kitu fulani kwa mazingira, kwa mfano kwake ni hiyo baridi, baridi inaweza kuwa chanzo cha huu ugonjwa wa pumu. Na ni vizuri sana ameeleza, kama wagonjwa wengi tu wanakuja wanasema mimi nikienda mahali kuna baridi ama nikinywa maji baridi ama nikioga na maji baridi huwa napata hii shida. Na wengi wao tukifanya uchunguzi unapata kweli ni asthma. Huko Kitale kwa District Hospital kunao madaktari na ninawajua personally ambao wanaweza kumsaidia sana. Siogope aende pale, aelezee shida yake na watamsaidia, watampatia yale madawa yanayofaa. Hii ni shida ambayo inaisha ikirudi. Kwa hivyo si shida ambayo atapewa dawa naishe. Ni shida ambayo tunahitaji control vizuri.
Absolutely.
Ndio.
Daktari Munyu could not miss the opportunity to floss his great Swahili. We also just asking what is asthma, it's pumu. Kwa hivyo manake unafaa kuendelea basi ukieleza na Kiswahili alafu yaeleze na Kiingereza. Daktari anaitwa ni mganga. Wewe ni mganga? Daktari anaitwa
hiyo sijajua.
Oh.
Wajua lazima nitafute zile mbegu na
wow. Okay, sawa. The conversation today is on asthma. It's a good conversation. We're learning about how to take care of ourselves. And I think the thing that we've emphasized, and mostly still, if I just put together all the questions, because we have about 7 minutes, and I'd love to use that to give you just a chance to wrap up, is to find out what the triggers are. What triggers you into coughing, congestion. Another one who was calling in was saying, every time I take something cold, I get tightness of the chest. Is that...
Inawezekano mkubwa ni asthma.
Inawezekano mkubwa ni ugonjwa wa pumu. Yes. Yeah. So all these things, whatever it is that triggers you, and they need to come for a diagnosis, a proper diagnosis, which is very important. Let's pick Sabina as we wrap this one up. Sabina, good evening.
Good evening to you.
Thank you for calling Health Check.
Yes.
Go ahead with your question.
Mimi usiku wa leo last night kuanzia 2:15 sikulala. Ilikoa mpaka singeweza kulala, ni kukoa na sneezing. Na nilikuwa natoa makozi na nikienda kulala sikuwa natoa makozi hivi kama makamasi. In fact I couldn't sleep mpaka saa hii tu. Lakini nikasikia nimelemewa sana, kifua inafungana sana, ninakuanga na inhaler nikaweka. Sikusikia vizuri. Saa 10 nikaenda kusamusha maji moto, nikawa na kunywa kama chai kidogo kidogo. Na still ikaendelea hata saa hii nilikuwa na chafu na yani na koa na kusnitch. Saa hii imetulia kidogo, ndio nikafungua off FM.
Asante sana kwa kutuangalia. Do you have a follow-up question for her?
Kulingana na vile anaeleza, ina uwezekano kwamba ashaelezwa ako na asthma. Kama tulivyojadiliana hapo mbeleni, ni kwamba asthma si ugonjwa ambao unakaa hali moja. Kwa unabadilika, unaweza kuwa mbaya zaidi, inaweza kuimarika zaidi. Na wakati iko mbaya zaidi, ile dawa ambayo mtu anatumia kila siku huenda isitoshe. Kwa hivyo anastahili aende hospitali, daktari amwangalie ili aongezee madawa, ingawa kwa muda mfupi, ambayo itasaidia kuleta hiyo hali kwa chini.
Okay, so tumeelewa that asthma is different seasons, different times, even for children and for adults, and it manifests differently for every single individual. Let's just wrap this up. What advice would you give? And especially, I loved how you talked about the usage of the inhalers, because people are using the inhalers and they're not using them effectively. So even just as you wrap up.
So we'd say anybody who coughs repeatedly, recurrently, or wheezes or gets chest tightness needs to be properly assessed in a good health facility by a good health worker, and then be diagnosed correctly. There are many other things that can cause the same cough or the same wheeze. And then once they are put on inhalers, then they should be on regular follow-up. Regular follow-up could be weekly for those who are very uncontrolled attack. Could be after 2 weeks, could be after a month or 2 months, could even be after 3 or 4 months, or even 6 months, depending on how well they are controlled and how well empowered they are in terms of managing their condition. So what we are saying is that, being a recurrent condition, they should be on regular follow-up in a clinic somewhere.
Okay.
That is that.
Absolutely.
Yeah.
Well, our pediatrician is in a clinic somewhere at Mpisha Hospital. That's where you can get him. Dr. John Washira. Just go and ask for the best pediatrician of Hope TV. They all know. Sawa, you'll get him and they'll direct you. Someone was asking where they can find you as well. As we wrap this one up, what's your advice to adults and just their culture on taking care of themselves with this condition?
The key thing is, one, getting the proper diagnosis. So people should not stay at home when they are coughing, when they are having wheezing or chest tightness. It could be asthma, it could be other things. Let that get sorted out. Secondly, if one is told they have asthma, denial is a major thing. Many people will run here and there saying it's pneumonia, or some have even been put on TB treatment, others have been told they have all manner of diseases, rather than saying, actually I have asthma. So once you have been diagnosed to have asthma, please tell your doctor, I'm coughing and I know I have asthma. Let it be the doctor or the nurses or the CEO's work to determine, is this an asthmatic attack or something else? But cut to the chase and tell them I have asthma. Number 3, adhering and complying with the medication. If your doctor has advised you to use your medicine in the long term, he means that, so that your control is very good. Many people stop their medicines, then they get the attack and they are surprised, why did I get the attack?
You stopped your medicine. Wow. Let's take care of ourselves. Let's do better. Now that you know more about asthma, it's okay for you to go ahead and get it diagnosed. You'll be able to manage it better and manage all your conditions better. I want to thank our doctors, Dr. John Washira, pediatrician. Thank you so much for your time always. We appreciate you so much and God bless you. And of course, Dr. P.W. Munyu joining us as always, our pulmonologist. Thank you so much. And it's encouraging, there are actually more pulmonologists coming up. You're encouraging others and mentoring more people to come up. My name is Kerry Kagiri. I have to wish you a good night. I want to tell you not to switch off Hope TV because we have great programming lined up for you. Coming up, of course, News Watch, and we'll get to see you on Team Worship Wednesdays on Hope FM, 5 a.m. 5 a.m. I'm able to wake up. How about you? So join us for the sweet hour of prayer and just a great time in God's presence. Thank you so much. Share this video, like and subscribe to all our social media platforms. There you can get informed on what we're up to, what we're doing. I'll see you after 5 weeks. I'm going on leave. Bye. I'll see you soon. Let's go home. Oh yes. Oh, let me just quickly say who will be sitting in for me. It's the beautiful, the amazing, the talented Binti Grace Kiroye Mutiso. So you get to hang out with her. She's awesome. So stay tuned. God bless.